And the last thing I would want to ask you about, obviously we're living in a very weird space right now where this is about as close as it gets, right? The back and forth across the screen and its effect in psychiatry and mental illness care, and the dissemination of information like this is all affected. Could you share some perspective from where you are right now as to what it looks like? And I guess, what are we learning as we do this?
Well, that's a very difficult question. I think there are both countrywide and also regional differences. I have to say that here in this university, we maintain a certain research level, and I'm leading a research lab. In fact, we also doing research on SARS-CoV-2 and the possible consequences on neurons and neuronal cells. And, with the idea, of course, could there be late effects of this virus on the brain that could maybe favor some chronic brain diseases. And so it's a difficult situation. It's, you will have to weigh, every aspect of this scientific aspect and also, everyday life aspects, economic aspects against each other. And this may change every other week. So I think, we're good to have a rational, let's say, take of this whole situation.
Is there a lot right now, and sorry for asking in this way, but it's something that I think might be an aside, because when we talk about mental illness during this pandemic, it's been more of the anxieties that people are suffering from and the greater rate of stress and depression, suicidality risk. There's been some back and forth on that. Is there concern that the virus itself might have some burden on mental health?
First of all, we don't know. Yeah. These studies should be done and will be done and are ongoing as we have these cases, but it's far too early to tell. We know from the previous SARS pandemics or epidemics, we should say that, the SARS in 2003 and 4, that they are neurotropic viruses as the other coronaviruses. So they can go into the brain. We have just published a paper in PNAS where we investigated the influence of influenza on chronic brain effects, and we've seen that it leads to a disturbance of proteostasis and eventually an aggregation of proteins. So it can have profound long-term effects. The question is, could this also happen with SARS-CoV-2? Possibly. We have to investigate this. Viruses, we know this for decades, that they are responsible for all kinds of things, including cancer, of course. For the brain, it hasn't been established, but it's well known also to affect Alzheimer's disease. Thinking about herpes viruses, this has been discussed. So we should, this is definitely an important direction of research.
Certainly. And looking forward to learning more about that and understanding a little bit more. Obviously, I think every specialist in some kind of way is going to be playing a role in the very near future when we get back to something resembling a normal sense of living, especially for those patients affected. We know about the long-term burdens that these patients can be facing from similar viruses. So that's great to know. Is there anything else you want to add, Doc, relative to that?
Well, thank you very much for the invitation and for the interest. I appreciate this interview. It was well done. Thank you.